Ladies, we are meeting you where you are. It's time for episode 9, Hangry for Sleep.
Once you have one problem with sleep, these other problems creep out.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
People really do put sleep on the back burner.
A fascinating interview with Spring Boeddeker. She's a nurse practitioner who works at Essentia Health in the sleep medicine department. Just a wealth of sleep knowledge. And you know how it is. When you want something, you become very interested in it. So, I'm a wanter and a lover of sleep. So Spring and I connect on a parental standpoint on sleep in kids. While her expertise in the sleep clinic does deal primarily with adults, she helps with that mother perspective on a personal level. Seeing the signs of your kids who are hungry for sleep, when the best time to do homework is, those kind of things. So I really think parents are going to get something out of that talk with her about kids and their sleep. But also, specifically, we're going to find out why she likens herself to a kind of life coach, and that sleep is so much about life with how it's affecting our overall health. We discuss how the overall impression of most adults is that their sleep isn't so bad, but then the reality shows usually a big difference. And some myths, like person's weight used to be one of the main factors when it comes to sleep disorders, and a major focal point. Now, current data showing that there are a lot of other varying factors that play a part. Age, gender. It might be a more even playing field than you'd think. So let's get to it. Well, given that it's your namesake, Spring, I have to ask, is that your favorite season?
No, not really. I guess, since I moved to North Dakota, maybe because it ends winter. Yes. But it seems like we're not blessed with a lot of nice springs in North Dakota. Sometimes it goes from winter to summer. Yeah. So I do love summer. Yeah. I mean, I think most people in the North probably just treasure and can't wait for summer.
You said a great word, treasure it. I mean, we do kind of treasure summer, right? It just
every day.
Oh my gosh, it's like lightning in a bottle. We caught it. Let's enjoy every darn second of it. We're going to talk into seasons and how that relates to sleep, probably come up in natural conversation. Thank you so much for joining me on this Dare to Ask podcast. Will you tell me a little bit about yourself?
I went to a guidance counselor at a 2-year vocational college close to my home. I'm from Southern Illinois. They said, well, you took a health class and you have a good GPA. Do you want to be a nurse? And I'm like, okay. So that's how I became a nurse. Wow. So I started with a 2-year RN. Then I got my bachelor's, and then I got a master's in mental health nursing. And then at that time, because we're talking 20 plus years ago, the role of the advanced practice provider wasn't what it is today.
Yeah.
And I had more of a background working in like critical access hospitals and things. So I'm like, maybe I should go back and be family nurse practitioner. So I went and got my certificate. So that's like postmasters as a family nurse practitioner. And my first job was working with a neurologist, private practice, and he was a sleep physician also.
Oh, wow. A huge influence too, clearly, to bring you to where you are today. What about family? So you say you're from Illinois.
Southern Illinois. Yes. I went to Southern Illinois University to Edwardsville, and a lot of people know Carbondale because they play, I believe, the Bison. Yep. It's the same university, but the campus I went to was Edwardsville. And so it's in the metro East St. Louis, but I'm from a rural area, not unlike Hillsborough where I live now. I have sisters who are in the military, so I've traveled quite a lot, and I've lived in different states and do like rural, and the patient population here in North Dakota is usually very easy to work with people here.
The busy season, of course, being that end of year. Why is that the busy season in sleep medicine?
Well, I believe as Americans, it's just kind of built into our personalities and our culture that sleep is somewhat of a wasted third of our life, which would be a big biological mishap if a third of our life was wasted. But because of that, people really do put sleep on the back burner. They will push off getting testing for sleep problems until the end of deductible year, or if they've met their deductible. So that really makes the last few months of the year pretty busy in the sleep clinic. We have been pretty busy year round. Of course, in the winter with travel, it does slow down a bit because it's hard for people to come in. We do serve a lot of rural patients that have to drive in for appointments, so it's not always safe for them. So we do see some. Traditionally, the last 3 months of the year has been our go time.
Yeah, your go time. You in your personal life, you're probably putting some things on pause during the busy times.
I love the summer, so which is good, I guess, working in this department because we tend to not be as busy.
Yeah.
I love to garden. I live on a small farm. Husband does have a lot of cows, different types of birds. My kids are involved in 4-H. We have horses. We have a few donkeys that came with some cows my husband bought, and then they became kind of part of the yard animals. We have a lot of dogs and cats because we live on a farm and we really need the cats to control the rodents. We breed German Shepherds, so we have a few German Shepherds, and I like that on the farm because they keep the critters away, the ones we don't want there. I have 6 children, 3 small children that are in the home, so that keeps me pretty busy because they're just starting into sport. I have a 9, 6, and 4-year-old at home. It's a lot to manage.
It's almost a joke that I say, what do you do in the pause? Because there is no pause.
I have a lot of games focused towards kids learning sight words and those kind of things that I've had to learn to enjoy, learning songs so that they can learn their sight words. And I have 3 older children, and things were different when they went to school. My oldest son has dyslexia, so there was a big learning curve on how I can teach him, and they're very active boys. And in the winter, it's a struggle because they've got a lot of energy and they can't go outside and spend the hours like they should.
What ages are your oldest kids?
28 and 22. And then I have a 29-year-old.
You really do have a huge gamut.
I've got 6 years in between 2 and 3, and I think it was 12 before Rowdy was born. So I do like the fact that I've done this before, so I do come with some experience, but I'm hoping that I've learned from that experience. But, each kid is different no matter what, even if they look exactly like certain members of the family, they are definitely different, no doubt. So individuals with similarities, so sometimes those previous skills do come in and help. As humans age, we become a different person too. So I've definitely changed in the 30 years. And I have 5 boys and only 1 daughter. And then my daughter now has just had her 4th son. So I came from a family of 4 girls. So it was definitely a learning curve with all these boys because that's something I did not grow up with.
I think you brought up such a really great point is how much we change over the years. There was a 10-year gap from my oldest to my now youngest. I recall the difference of just simply the pregnancies and how different my body was responding as a 35-year-old being pregnant as opposed to a 25-year-old being pregnant.
I would definitely agree with that. And a lot of it has to do with sleep, coincidentally.
Oh, my goodness. Let's talk about that because we're touching right there. But children and sleep. How important sleep is for a baby, how important the structure and the schedule of sleep is, and how much sleep, quality, all of those things. Very important. That's something that I've always, and my husband, have made important for our kids is their sleep. Are we hitting the mark here?
As a younger adult, there were more resources for parents. I really do. And I will say that I don't treat children we only do adults at Essentia. Yep. But
from the mom's hat.
Yes. And one of the reasons I was drawn to sleep is because I struggle with both insomnia, restless leg. So I struggle with a lot of sleep disorder. I have 2 of my 6 children that have inherited a very similar struggle. Yeah. From that perspective, I can't say enough how important being very protective of my own sleep translates in how well I can help them be better sleepers. First, as a model, they're going to look at me and look at kind of my routine and what I'm doing. Two, it's how I can be more patient and less irritable because of being sleep hungry or sleep hangry, however we need a
term for that.
Yeah.
Since we have hanger for hungry.
Yeah.
Hungry,
so
we need a sleep hanger term, don't we?
Yes,
we
because
need to workshop this.
because there's lots of people, patients describe it as moody and irritable when they don't get enough sleep, but it's different than just work stress or just
really
life.
is.
Yeah, it's the brain is ready to sleep, but it's not going to happen. So you have to push through, and then you're dealing with
you have this attitude,
the sleep deprived side of the brain. So it's not good. But I do feel that keeping kids on a schedule, and people in general, their brains are wired differently, and they are more sensitive to changes. Brain is not as flexible in some children and people. Therefore, small disruptions translate into big problems with their sleep quality, the ability to fall asleep, stay asleep, and wake feeling rested. And then for kids, they're such a bear in the morning, or it takes them forever to eat, or they don't want to get dressed, or they cry when you drop them off. But it's bigger than that, because it's going to affect them. And if they're not taking naps, it's really going to affect their ability to learn, because there's so much that happens during the night. Like for kids, it's even more than a third of their life they should be spending sleeping. There's a lot of work that's happening in our brain. Otherwise, what a biological waste of time it would be. So those kids need quality sleep if we want them to perform in school. And I can't help to think, and I don't know how much research is out there on this topic, but some of the issues with kids in school, I think, has directly related to poor sleep.
I agree. Just as a parent to my own children, speaking on their behalf, so true. With my two youngest, since a lot of their homework is at night, like you had mentioned, sight words, it's stuff like math facts and sight words and memory work stuff. After a certain point in the evening, forget about it.
7 o'clock. I might get it 7 o'clock. If you don't get it done before then, you're just...
It's not happening. Yeah. It's almost just you're regressing.
Yeah, you're torturing them and yourself. Because you're frustrated because, hey, you knew this yesterday. Yeah. Where did it go?
Yeah.
I've already worked with this. This was supposed to be the easy part. But their brains are hungry for sleep. They're more sensitive to circadian rhythm changes. And in the northern latitude, we really at a disadvantage. When it's dark outside, it's not as easy for them to sleep more than even adults. So we're asking a lot, and they've already put in a lot of brain work all day long. And I know we as adults, we go to work, but we've usually done that job for years and years. These kids, each day, they're learning something new. They have more expectation each day. Like they're building up on the pyramid, where we learn a little bit every day, of course, but it's not the same volume. And of course, their brains are younger and they can retain it a lot. They can pick it up a lot quicker. But at the same time, by the time they get home and you get your busy work done, feeding them, bathing them and stuff, their brains are spent. They need downtime. Yeah. And for most working parents, though, we don't get them right after school, so we don't have that little bit of time before supper that we could probably have some productive homework time.
Yeah, it's a challenge, no doubt, for every single parent, every single child. I wish there was that formula that would work for anybody. Like you said, the brain is already wired differently. So sleep is important. But yeah, we kind of have to adjust parenting every kid and ourselves in what we need every day. You've given me some good nuggets, like that I can actually apply to myself. Good. I'm already thinking of, when are some different times we can be working on homework.
Sometimes just waited till the morning, because there's usually a gap before they have to be dropped off at school. They're going to be way more efficient and productive. Of course, the older I get, the more of a morning person I am than the night owl. Yep. So I'm more productive in the morning and probably a lot more patient with what they need to get done or the help that they need.
Let's talk adults, because this is your specialty and getting into sleep medicine. How long you worked in the sleep at Essentia Health?
It is 5 years. 5 years, maybe 6 years. No, it would be 5 years.
Okay.
And then 2 years and some change before, like when I first became a nurse practitioner 20 years ago.
Okay. So since you've been in this, is this home? Like, do you love sleep medicine?
I do love sleep medicine.
Yeah. Explain to me then what that looks like for you in your day-to-day or every week, what you are doing specifically in sleep medicine.
In some ways, I'm kind of a coach, a life coach.
Yeah.
I really try to help them know what they need to do. And a lot of people do know, but they just need
that coach.
They need someone there trying to help them and help them understand how sleep translates to health. There's a lot of cardiac burden from untreated sleep disorders. I mean, amongst other, we all know mood, anxiety, untreated sleep disorder breathing can really impact. It raises the risk of heart attack, stroke, cardiac arrhythmia. It does a lot of negative things. And it's not like I'm a real data person, but I've got an article that was published in 2021, and it's from the Journal of Clinical Sleep Medicine. And it's even older data. It's 2018. They looked at the direct medical costs, and these are direct costs. So this isn't the indirect cost related to sleep disorders, and it was $94.9 billion annually. Oh. And since the COVID, I'm sure this number has only increased. The patients with more significant respiratory disorders that were identified during hospitalizations and post-pneumonia and things have went up. It's definitely expensive, but still not as, like we talked about with the deductible year. It's really not the first thing when people think of, oh gosh, yeah, I'll take the antibiotic, take the breathing treatments, I'll treat my blood pressure, my diabetes. But when it comes to sleep, they're like, oh, I think I sleep okay. I'm sleeping pretty good. They really downplay it. And the Lady Gaga song, we got a million reasons why. We've always got a reason why we don't sleep good, or your mouth is dry from the medicine. It's not because you're snoring all night. It's not because you've got an obstruction in the nose. And because humans, we innately want to help cure ourselves, Sure. Reluctant to come see me because they don't want me to say, oh yeah, you got to lose weight and you'll quit snoring. Or your wife's right, you need to lay on your side and go on a CPAP. A lot of people do get bullied to come see me because they've been kicked from the bedroom.
Probably hurts a little bit knowing you've been rolled in here basically.
Yeah. I just want them to feel good. And I mean, I don't want spousal alienation or alienation in the bedroom because of snoring or limb movements of sleep or fighting out. There's a lot of other things that can alienate the bed partner. But there's a lot during sleep. There's a lot of individual time and discussion that may not be able to happen any other time of the day because we're so busy, and then we got little ears everywhere. Time is valuable for intimacy and for decision-making, discussion, talking through, maintaining that relationship.
It's important. So I like that you say that too, because there's a lot that goes on. What would your guess be of the patients that you see have preventable things that they could be doing prior to coming seeing you?
It's hard to say that because the burden of sleep disorder breathing, we used to really focus on weight. And not that weight doesn't play a role, but we really underestimated. So I'm talking 20 years ago when I worked in sleep, we did sleep studies on middle-aged overweight men. Now,
it's
all bets are off. Yeah. I have a 20-year-old that comes in, an athlete, but he says witnessed apnea is tired, snoring. I'm going to study him because otherwise I'm going to miss the opportunity to prevent something because moderate to severe apnea does not resolve with weight reduction. And we know this because we've got lots of patients post-gastric bypass, and it's still there.
Yeah.
I think it's 25% of people are normal or underweight that have significant sleep disorder breathing.
Wow.
Traditionally, we wouldn't have studied. They're not the poster child.
Sure.
And women really are underrepresented. Women were not even included in research on sleep disorder breathing until, I think, 1993, 94. So
that's mind-blowing.
Because it was just too complex. Our sleep was just too complex, it was thought at the time. But now we know. What I would say is that it is harder to identify women because they're more stage dependent and position dependent. So a lot of women have markedly increased respiratory events in REM sleep and then positional, like on their back or on their side, usually the back. And of course, we do one night study usually, which if we don't see them in enough REM sleep, and women, because of the way our sleep architecture is in women, we tend to be more more second part of the night, heavy in REM. Men can have that a lot earlier, the way they go through sleep cycles. So if we don't get a good morning sleep, and in our sleep lab, generally patients are done with sleep studies by 6:30, and that's just kind of the way it works out best for patients and us. But this patient would normally sleep till 9. We could be missing a chunk of REM, so we would underestimate their burden.
Wow.
The home sleep test, I think that helps a lot, but in women, the home sleep test doesn't have as many leads to really determine milder apnea. And of course, women tend to have more limb movements and fragmented sleep. The home sleep tests do not monitor brain waves, so we really can't calculate, because it's an average, it's a mathematical calculation. We can't really calculate the minutes of sleep versus the events, so we can underestimate there too. I really struggle because a lot of people want home sleep tests. It's less expensive. Insurance prefers it. But there's always this part of me that knows, we may be underestimating the breathing, and it only looks at breathing, and then we may be missing something else like limb movements of sleep. Not everybody feels the restless legs, but the limb movements may be there profoundly affecting the quality of their sleep. I warn them of that, but a lot of times we don't always get a say to. The insurance kind of decides, this person's healthy enough to have a home sleep test. Well, home sleep tests were really only, you're supposed to have a high pretest probability for sleep disorder breathing. If you have moderate to severe sleep apnea,
a lot of people then
should be able to see that quite easily with a very limited study. Much easier to see in men than women.
Instead of a negative, I'm looking at it from a how much growth we have yet to see in this specific field. You yourself, 20 years, and you've seen so much change and advancement. So what excites you about the future next in sleep medicine, and maybe specifically in women?
I pulled some data because I wanted to know what was our breakdown of male to female, and then age range, patient population, because I can make assumptions and guesses. And when we're talking young people, less than 27 years old, 62% are female and only 38% male. So we see younger females seeking care for sleep disorders.
Okay.
And then between the 27 really up to 80 and even over 80, it's 50-50, which I assumed it would be predominantly men because we see a lot of sleep disorder breathing, and we see, it seems like we see more men presenting for that. I was very surprised by this to see that the bulk of our patients are over age 27, but it's more 50-50 than I ever imagined.
Oh, wow.
20 years ago, that was not the case.
Right. People are finally getting it, how important sleep is. And what they're getting is their lack of it. The current trend right now is, how do I get better sleep or more sleep? Social media like TikTok. One of the trending things is brown noise on TikTok, and what that is and how that can help a person fall asleep. The difference between white noise, it's different tonalities. Also, weighted blankets. I mean, these are things, they're having a moment right now. Sleep gummies and sleep drops. People, it feels like, are taking their sleep a little more seriously. And so maybe that's trickling into the data that you're seeing.
A lot of people don't know if they really have.
Is it?
Yeah,
Do I
exactly.
have it?
It's just everybody I know has the same problem. We do a lot of consults where there's possible multiple things going on. Leg movements, some snoring, who knows, maybe sleep disorder breathing, insomnia, which once you have one problem with sleep, these other problems creep out. So breathing issues, snoring causes insomnia. Lack of deep sleep causes parasomnias and limb movements and all this other stuff to creep out of the woodwork.
Snowball effect.
Yes. And then after a while, some of these just become behaviors because your brain is used to this, teasing all this out and trying to put out every little fire, identify what we can fix and what the patient has to work on, what could be medication side effect. We see that often.
Sure.
And I see a lot of females that are having this subjective complaint. They just want to know. My memory isn't as sharp as it used to be, and I talked with my primary and they ask a few questions about my sleep or weight. If weight's going up inappropriately, that's another big reason for referral. Is there something with sleep quality? Because we know the role that inadequate or poor quality sleep has on obesity.
Can anyone call you and set up an appointment, or is it all referral based?
We do have an open clinic. We have self-referrals.
Are you happy that people are taking that initiative?
Yeah, I think that the more patients we have looking at sleep, in healthcare, one of the least expensive things that you can do is see a provider and get an opinion. You don't always need a sleep study. Sometimes I just look at it and it's like, okay, this looks more like just garden variety insomnia. Let's work on some behaviors here and see where that gets us. Not everybody would follow up. I'm only guessing that some of those things, they just need reinforced, and they did fine after they fixed the problems that they had. Now, of course, testing's expensive and things like that, but I think that having somebody look at doing a sleep consult and really look at the nuts and bolts of what's going on in their life and what I can tell them they can fix on their own is a good thing. I feel like people are really paying more attention to a lot of physiological recordings from Fitbits, Apple Watches, and smart beds, how it records your sleep, whether it's normal or not. Now, of course, some of them have oxygen saturation, which is like, okay, if your oxygen's in the 80s and this is legit, you probably got some serious breathing issue here.
Rings now and that sort of thing that are monitoring these heart rates and the oxygen levels and stuff. So the interest is there from a personal space. I got my first Fitbit 7 years ago when I was pregnant because I kept getting so lightheaded after a certain heart rate. I need to monitor this a little closer. So I need to have a monitoring device on me. And since then, it's almost, it would take a lot for me to not wear one anymore because I like seeing that data about myself. I didn't get much sleep last night. And I look at that and I go, okay, that makes a lot of sense. I only got 4.5 hours of sleep.
So the data, I like to look at it in clinic because patients, I ask them, how many times do you remember waking up? Oftentimes the data will show many more times. And if there's a big gap that it says they're awake and don't remember, well, it makes me think, okay, do they have a parasomnia that they're moving or just limb movements of sleep? Frequent ones are sleep disorder breathing. And I've even had patients that I'm treating for sleep disorder breathing. Their Apple Watch says that they're in AFib, so we find that out, and then they need modification to their treatment plan because the machine that is not effectively controlling their sleep disorder breathing. Did that cause the AFib? Probably multiple factors did, but I am thankful for this technology for that because it does help me as a provider. It alerts me to the problems. Where I see it's detrimental in people who tend to be more on the anxious side, people with insomnia who check the clock a lot, sometimes they become very fixated on numbers. And, if you read 7 to 9 hours for heart health and that kind of thing, well, there are short sleepers and long sleepers out there. And people who struggle with insomnia do better on a little shorter sleep because otherwise they have this inefficiency during the night, more likely to wake up or have trouble falling asleep. So sometimes too much data fuels their drive to be anxious. So sometimes I said, okay, I think you need to lay off that for a little bit and let's just work on how you feel and how the sleep is going, not the numbers. And that's one of the things with the insomnia. If people aren't sleeping well, but they have plenty of energy, then that tells us that this is not affecting their quality of life. There is a phenomenon called sleep state misperception where we feel like we're not sleeping, but technically our brain is. The waves are asleep, but we feel like we're not. And it's fairly common, but it's very hard to understand, to grasp, and to overcome that perception. They're misperceiving being awake when they're actually asleep.
Wow. Certainly not cut and dry. It's not black and white. There is so much gray area when it comes to sleep medicine. Feelings on weighted blankets.
I think it's a good thing, especially for people who have an issue with limb movements of sleep.
Oh, nice.
Because that's one of the non-pharmacological treatments for limb movements and restless legs is weighted blanket.
Blackout curtains, the seasonal time. Is that one of your recommendations?
Blackout curtains are good. They are usually needed in the summer. But if you live close to a street light or something that's bright, year-round, well, you better use them year-round. The tricky thing is if you do wake in the middle of the night, you should open them so to try to get some sunlight in the morning for natural waking. The shift workers definitely blackout curtains.
Yeah.
I mean, because we have to try to help our body's circadian rhythm whatever way we can, and that would be in the sleeping area, you definitely want blackout curtains.
Body needs that. The
Yes.
natural production of melatonin.
Our brain is not on a 24-hour circadian rhythm. We have to help it.
Yes.
So because of our latitude, it's more difficult because, like I said, short days, not enough light in the winter, too much in the summer. So the ways that we tell our brain it's time to wake up is light, activity, and eating pattern. You have to kind of start shutting this light down a couple hours ahead of time. And just like melatonin, the pineal gland secretes it. We have to time the melatonin. If you do like to do things outside or your house is bright, you're going to have to wear sunglasses or some kind of darkening just to help.
Oh, sure.
And then, of course, your eating pattern then would have to switch too. Activity level, you wouldn't want to be very active or exercise much in the evening time because you're going to have to try to shift phase. It's difficult. Some people seem to do really well. Their brain is flexible, but the majority of the people aren't.
Yeah.
And each decade of life, our brain loses some resiliency. When you're in your 20s, you can kind of run on empty.
Yes.
You can burn candle at both ends. But each decade after that, if we want the brain to perform, we have to give it what it needs that night. Otherwise, you're going to have to accept less performance out of it.
That's unacceptable
Yes,
these
that's
days.
Unacceptable.
We're Americans. We need to be able to do all at all times.
There are different options, too. There's goggles you can wear. There's hats. There's light boxes. There's, for people who don't work outside the home, I always say you need to be having your home office with a southeast window. You need to be in the sunlight. Our body does need it. We need vitamin D, too, but you can't always get the natural sunlight because of the cold.
So some of these, new pieces of technology, worth exploring at least. Do you have a health nugget that you like to pass on?
I oftentimes, when patients are struggling with routines, and I tell them anything that I really need to get done or I really want to start as a routine, I have to do it first thing in the morning. Otherwise, your day will be hijacked and your motivation wanes, your energy level wanes as the day goes on. So whatever it is, if it's really important, you need to put that first and then move on with your day, and you're much more likely to incorporate that into a daily schedule.
That is a good piece of advice. What would you suggest if people are listening because they saw the title and they thought sleep medicine, I struggle with sleep? Is there a call to action that you would have for those people?
Reviewing sleep hygiene principles, and you can find those a lot of different places online. Making any changes that you're physically able. And then if you continue to struggle, to come and get a consult. And sleep department is very much a team approach to healthcare because there's not one size fits all. And what's important to me as a provider for your health may not be number one for you. It's just maybe not the right time or doable. But in the future, if things settle down, then they can readdress it. And as long as patients are aware where we're at and what we do, then they can always come back and get reassessed.
Thank you so much for your time today.
You're welcome. It was fun.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.